My name is Abigail Hardy. I'm a fourth-year medical student.
Hi, my name is Carl Russell. I'm a second-year MD PhD student, and I am an executive member of the Students for the Prevention of Kidney Disease. So the Students for the Prevention of Kidney Disease is a service learning coalition under Niki Messmore. And what we do is we partner up with the National Kidney Foundation of Indiana to go into communities and do kidney screenings.
Students for the Prevention of Kidney Disease, or SPKD, has existed for quite some time. It's one of our longest running service projects. SPKD attracts students from a lot of different backgrounds. Often they're students with an interest in nephrology. We certainly have a shortage of nephrologists here in the United States, and so it's always exciting to give students that opportunity, but also students interested in other specialties as well. With kidney disease, a lot of people don't understand that your kidneys are a vital element of your body. And so when folks have kidney disease, it makes treatment plans across other specialties much more difficult as they work to incorporate the different requirements of that disease.
I think kidney health is very important, and it's not something that we think about or talk about all the time. I feel like from a layman perspective, a lot of people know what your heart does, they know what your lungs do, they might know what your liver does, but nobody really pays very much attention to the kidneys. When things go wrong with your kidneys, it can go wrong really quickly. And my husband's a paramedic. He used to transport dialysis patients, and hearing their testimonies of how they maybe didn't realize that their kidney disease had progressed until it was at a later stage really inspired me to get involved.
Involvement in Students for the Prevention of Kidney Disease allows students to better understand not just kidney disease, but also what are some of the contributing factors and how might kidney disease affect a patient as they move through their lifetime. Kidney disease is something that no matter what specialty you're in, you're going to have patients with kidney disease, and it makes their treatment often more difficult. Our medical school curriculum is excellent, training students how to do clinical reasoning, how to work with our patients, but where service learning gives our students the edge that they need to compete at the highest level is it allows students to immerse themselves in their communities, work alongside their neighbors, and really get to understand different cultures and different social issues. What this allows is students to provide better treatment plans for their patients, and service learning helps students to understand who the patient is as a person.
So as a first and second year student, it's really wonderful to be able to go to these screenings and actually see the implementation of what you're learning and understand the physiology of, like, why would someone with chronic kidney disease have hypertension, or how could hypertension put someone at risk for chronic kidney disease based on the pathology we're learning during our first and second years. And then as a third and a fourth year student, you have more of that clinical knowledge because you've been doing clinical rotations. And at that point, you can kind of interplay what you've seen in the clinic and maybe start mixing in your own clinical style, how you talk to patients, with how you're counseling patients at our screenings as well.
Work done in the Students for the Prevention of Kidney Disease has given me a greater appreciation of kidney concepts. Previously, I was just peripherally interested in what nephrology is, what kidney disease are, but now I'm in my renal unit, and I'm really learning these concepts in depth. I have a much better appreciation of what I'm doing at these kidney screening events and what the nephrologists are teaching patients.
So one of the great things about SPKD is our students are partnered with the National Kidney Foundation for their many health fairs around the state. One example of one of SPKD's recent service projects is the 2 Sweet for Your Own Good conference, which allowed students to provide kidney health screenings to community members. This allows our students to get to know folks as individuals when they come to the health fair, to be able to take their vitals, to be able to counsel them through kidney health education, and so much more.
Yeah, so with our no-cost kidney health screenings, it's open for everybody, so we don't care if you have insurance, no insurance, doesn't matter. We just want you here so we can test to see what your kidney health is. The students from IU have just been a miracle to us. We would not be able to do what we do to help serve our communities without their help.
Now, the students have worked with us not only at 2 Sweet Conference, but with all of our screenings, and they have been amazing. So the students came on board, and the organizers have always been so good at finding us the appropriate number. They learn our screening, and they can do it without us, really, at this point. But yes, they've been amazing. We really could not do this screening without them.
Yeah, so we serve a wide array of populations with our community screenings. We go all around Indianapolis, but We've also done some screenings just around the state of Indiana. I would say the community that we're trying to target is underserved populations who might not have insurance or might have difficulty getting access to a doctor. In Indianapolis, it's very diverse. We do screenings at the State House, so we've taken care of lawmakers and legislators, and then we've also done screenings at community churches and just taking care of the local community there. Oftentimes, we can look for those silent markers of their health, like hypertension, that they might not necessarily know they have high blood pressure, but if we can detect that at a kidney screening, we can encourage them to go and get follow-up with a doctor and help coordinate resources there for them.
Our SPKD students are phenomenal. This is one of our longest running service projects. And the time that they invest in building these partnerships and attending these events, often which are weekend events, I think speaks highly to their values, as well as to the type of physician that they'll be. I hope that we have more students who become involved with SPKD because it really allows them to get some greater insight into the communities that they serve.
So how people can get involved with kidney health in the community is we have a lot of kidney screenings, especially medical students. Come out and volunteer. We always need volunteers. It's a really great way to interact with patients, with people, and to practice your clinical skills a little bit. There's several different fundraisers, and with the National Kidney Foundation of Indiana, they do 5Ks. They have a gala. So those things are really rewarding to be a part of.
It's so incredible to see so many of our prior kidney transplant recipients and their family members and just see how it's completely changed their lives. So if this story is touching to you or if you're interested in kidney health, I would definitely encourage you to get involved.